right-sided heart failure, COPD can increase pulmonary hypertension, and it just can increase the right ventricular workload. So just know, COPD can cause heart failure, and COPD worsens heart failure. So it can kind of be like a vicious cycle. Some COPD questions. A patient with COPD needs oxygen. Which of the following would deliver the most accurate concentration of O2? Nasal cannula, simple mask, or Venturi mask? So we want to know exactly how much oxygen we're giving this person. Venturi mask. We can estimate what they're getting with the nasal cannula, but the Venturi mask, we can actually set what we want our O2 concentration to be. A simple mask, I mean, it's only going to deliver how many liters you give them, but we don't use those on the floor anyway, I don't believe, so I wouldn't choose that answer. What is the primary risk factor in the development of COPD? Smoking, yeah. Very obvious one. Which vaccinations are important for a COPD patient to have? Yep. And then the reservoir bag of a partial rebreather must remain inflated during inhalation, exhalation, or both? Both, yes. I can't tell you how many times even the anesthesiologist will bring patients out of the OR and their non-rebreather bag will be deflated, and I'm like, well, that's doing nothing. So just always make sure that bag is inflated. And then the difference between a non-rebreather and a rebreather mask. The non-rebreather has a one-way valve, so that the air you breathe out, it doesn't go back into the bag, so you're only breathing from the reservoir bag, and that's why it's so important that bag has to be inflated, because if it's not, basically they're just rebreathing their own air that they're breathing into that mask. Okay. ABGs. So I'll be honest with ABGs, I go through cycles with understanding them and not understanding them, because unless I'm actually reading them and like acting on them, I'll forget everything about them, and then I'll have to come back later on and re-look at the levels and what they all mean. So this is something you probably want to look at, because I know we have excellent respiratory therapists here who help interpret those levels for us. But on the test, you may have to interpret levels on your own, okay? So just know that the normal values, pH is 7.35 to 7.45 is the normal. PCO2, 35 to 45, and bicarb is 22 to 27. Imbalances, so obviously if the pH is less than 7.35, it's acidosis, and if it's greater than 7.45, it's alkalosis. And then the PCO2, which represents the respiratory part of this equation. So if the PCO2 matches what the pH is doing, it's respiratory. If it bicarb matches what the pH is doing, it's metabolic. But we'll review that in just a minute. But just so you know that. So with PCO2, if it's less than 35, it's alkalosis, and greater than 45, it's acidosis. And the bicarb, less than 22 is acidosis, greater than 27 is alkalosis. So that's kind of the range, and what the, when you go outside the range, what it means, that's what you have to memorize, okay? So then when we go to evaluate the blood gases, it gets a little easier. And people all have their own methods. You can do some people do the arrows method. I don't think you really have to do that, because once you kind of understand what the levels mean, it's not so hard to read it. And you want to get real basic with it on the test. You don't want to spend a half an hour on one question trying to read this gas. Do your best, move on. But just so like general understanding, what you want to do when you see these gases, we first evaluate the pH. because that's going to determine if this is acidosis or alkalosis. So the first number you always look at is your pH, and if it's reading, 7.55, that's going to be alkalosis, and if it's reading 7.15, you're really acidotic at that point. So always start with that number, and that gives you the second part of the equation, which is acidosis or alkalosis. Then we look at respiratory versus metabolic. Just the simplest way to look at it, whichever one, PCO2 or bicarb, that has the same imbalance as the pH will be the cause of the imbalance. So if this PCO2 is acidotic and the pH is acidotic, then it's respiratory acidotic, because PCO2 represents respiratory and bicarb represents metabolic. So if the pH is alkalosis and the bicarb is alkalosis, it's metabolic alkalosis. Kind of see how that is. So if you drew the arrows out, whatever arrow matches the pH is the one that is called, that's where it's either metabolic or respiratory. Now, if you get into more complicated ABGs, you get like compensated versus non-compensated. If you want to look at that, you can. I don't want you to put so much pressure on yourself with that, though. If you can figure out, is this acidotic or alkalosis, and maybe you can start narrowing it down at that point, okay? So we're going to keep it pretty simple with these practice ones, and I'm going to give you a website you can go to practice more if you want. So example 1, we'll do this together. The pH is 7.30, so that would be acidotic. And then the PCO2 is 53, so that's above normal range. So what does that make that? Yes. And then the bicarb is 24. That's normal. So what would this be? Yes. And that is correct. Okay, example 2. I'll let you guys do this one. pH is 7.51. So put down what you think. PCO2 is 47. And bicarb is 30. So what do we get for that one? Metabolic.
Acidosis.
Yes. Metabolic alkalosis. Okay. This next one, pH is 7.34. So that's lower than our range. PCO2 is 28. And bicarb is 15. So what do we get there?
Metabolic acidosis.
Yes. And then practice 4. Yep, this is the last one. pH 7.52. PCO2 is 28. And bicarb is 24.
Where's
Yes. Respiratory alkalosis. So, those are like the. Oh wait, do you have a question?
I was just gonna ask you about number 3. So, I forget. Is it because one's more off than the other?
Yes, usually.
Okay.
Yeah, and you gotta remember it's the one that matches what the pH is doing.
Yeah, that's right.
Yeah. So since the bicarb is acidotic and the pH is acidotic, we say metabolic acidosis, and you can see that the PCO2 is starting to respond to that. So it's starting to go out of whack because it is starting to compensate for that. Now I wouldn't say this is a compensated pH because what you might, when they want you to read uncompensated versus compensated, it's like when you'll start seeing results of the compensation. So maybe like your pH is starting to normalize due to the fact that the bicarb is rising to help bring the acidosis back down. Those are a little bit more complicated, and honestly, you can review those online, but I wouldn't say spend a wild amount of time on it. Okay, there are whole practice books on just reading ABGs. So you can get into all that compensated versus non-compensated, but just try to know when you go in the lab values, the basic way to read it, and then the other part of this that you wanted to be able to know is what does that mean? So you can read that, okay, this is metabolic acidosis, but what is that indicating? You know, what does that mean? So there's also the second layer of this, which is after you read the blood gases and you have your result, what does this mean for your patient? And we're going to review that here just a little bit too. So the PCO2 basically means the amount of acid in arterial blood. If more than normal amounts, either the body is making too much acid or the lungs is unable to excrete it. If less than normal amounts, the lungs are either releasing too much acid or the body has increased production of bicarb. And then bicarb is the amount of, that's alkalosis, the amount of bicarb in your blood is what the HCO3 is indicating. So if you have more than normal amounts, either the lungs are excreting too much acid, it's getting rid of too much CO2, or the body is producing too much bicarb. And if the body has less than normal amounts, the lungs may not be excreting enough acid, or the body has not produced enough bicarb. So you just want to kind of look at that slide and kind of get that straight in your head about what does different levels in the blood mean. So then it can help you kind of figure out what these different things are indicating when you start reading the questions. Cells need a normal pH to function. The body will always naturally attempt to return it to a balance. If the respiratory system is the problem, so if like a patient's hyperventilating and they're breathing off too much acid, the metabolic system is going to kick in and try to compensate for that. And if the metabolic system is at fault, so let's say you have an NG tube and you just suctioned out all of the acid in their stomach and now they have too much bicarb, the respiratory system is going to kick in and try to correct that. So maybe it's going to decrease your rate of breathing to try to help keep that CO2 in your body to even out the levels. Respiratory system can start compensating within minutes, and it can take minutes to hours to correct. The metabolic system can take days to achieve compensation. So that one's a slower reactor, okay? Causes of respiratory acidosis. So these might be just some good slides to review just before the test, because it can give you a hint if